Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, defeating D problems of defeat will help keep you on your toes. Then, if you know a senior who's home alone, we'll share tips for keeping them safe. Are your teeth troublesome? We'll tell you how to declare your independence from dental difficulties. Plus, we'll go behind the headlines of Cleveland history with a groundbreaking journalist. And how Ohio law discriminates against seniors who suffer injuries.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Do you feel like a heel for the way you treat your feet? Dr. Angela Grady is here with tips to keep your toes on top. Dr. Grady is a podiatrist with Metro Health.
Hi, Lori.
Welcome, welcome, welcome.
Thanks for having me.
So tell us how our feet fare as we age.
So as we age, there's a lot of things that we see. One of the major complaints that people have is that their toenails change. And this can become a real problem. The toenails can become thick, they can become yellow, they become discolored, they become crumbly. And what that causes, it can cause having a very difficult time trimming the toenails by yourself. You find that the clippers just don't cut through the nail anymore.
Is that simply because of aging?
No, it's not all aging. It's aging and it's also a fungal infection. Everyone sees those commercials with the little guy running around. The fungus takes up in your nail bed and then it produces that nail that doesn't look normal anymore. And it's, people are embarrassed about it, but it's very common. There are studies that show about 90% of people over 70 will at some point have an issue with the toenail fungus.
Wow, wow, wow. So what is causing the fungus then?
It's the fungal spores. They implant into the skin and then they cause
Is it from wet feet?
It can become from wet feet. That's one of the big things. Fungus like dark, warm, damp spaces.
Like inside shoes.
And that pretty much is inside shoes. So that's one thing that can cause it. So
okay. So if we're trying to avoid this situation,
yes, there's
getting
lots
older,
of things we can do to try to keep our feet dry. One thing is I tell patients to avoid soaking your feet. A lot of people like to soak their feet, but it keeps them wet and damp. Also, after bathing, to dry very well between your toes. That helps. Changing socks. Sometimes people wear the same socks a couple days in a row. When they get damp, that doesn't help. Also, drying between your toes. You can change your shoes every day. Even put a spray of Lysol in them once a day. And if you're going to be in public pools or locker rooms, showers, it's a good thing to wear a sandal on your foot so that you're not picking anything up that you don't want.
Yeah, that's a kind of a scary thought that you're walking through all kinds of nasties on the floor.
Exactly.
Kind of like when you touch things, your feet are going to pick it up the same way your hands do.
Exactly, and you're constantly washing your hands, but you don't think you're not constantly washing your feet, so it makes a difference.
So soaking your feet is not so good, but washing them and drying them really well would be a good thing?
Yes, drying well between your toes is absolutely necessary.
Okay. So in addition to having issues like this, do our feet change shape or size or anything as we age?
They don't really tend to change size. However, you can have deformities of your toes. They're called hammer toes or bunions, where the bones can develop arthritis and become more prominent. And then once they're more prominent, you notice that they might rub in your shoe gear, and you can develop corns or calluses on that area or even a wound.
Ooh. So our inserts into your feet. Oh, that's hammer
Those
toe?
are hammer toes. So you can see towards the tip of the toe, there's kind of that area that looks a little red and enlarged. And then you have to think, once that's in your shoe, if you have a very narrow, tight-fitting shoe, that's going to rub and get irritated and can cause a lot of pain and a lot of problems.
So those really stylish shoes that all the women should be wearing with the pointy toes and real high heels, not good, huh?
No, I don't normally recommend those.
And you also say for diabetics that they should pay particular attention to their feet. Why is that?
Yes, absolutely. Diabetics are more prone to have foot problems. They're also more prone to having infections in their feet. And also, they can develop peripheral neuropathy, which is a decrease in sensation in their feet.
Ooh, what can that cause?
So the combination of the decreased sensation, any deformities, and more prone to infection, you can develop wounds that can get infected. So what I normally recommend for diabetics is they want to wear shoes that have a higher, wider toe box, so it's a little bit more roomy, so there's not as much rubbing going on, and that tends to alleviate a lot of the problems.
All right. Wow, well, this has been very great information for us. So if you toe the line and follow Dr. Grady's tips, you don't have to get defeated by your feet. Need more footnotes? Use the information that's coming up next.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, safe at home.